Hello, thank you for tuning in to our Ask Me Anything session. My name is Dr. Janis Holt, and I'm answering questions about corneal eye disease. Some of the questions that have been posed for me today are, what is corneal eye disease? And what are the different types of corneal eye disease? I guess the easiest thing to talk about is, what is the cornea? And the cornea is the front clear surface, or the clear window of your eye. It's right in front of your iris. It's the outside clear window. And corneal disease really largely falls into two categories. There are those that are inherited, and there are those that are acquired. So, for instance, a trauma or something like that versus something that you got from your mom or your dad, or even back to your grandmother or aunt or uncle. What are some of the signs of corneal eye disease? The signs that you may have a corneal disease, usually that sign is blurred vision. But there are other signs, like you may have eye pain, or you might feel like there's something in your eye all the time. And that just may mean that that front clear window is irregular and that your eyelid may be catching on it. Or your blurred vision may be there because that front clear window is also foggy or blurred and you're not seeing well out of it. So those are the two most common symptoms of corneal eye disease: discomfort, blurred vision, or both. Someone asked, is corneal eye disease hereditary? They said their mother had a corneal dystrophy, and they were wondering if it's something that they could potentially get. Yes, that's true. You could potentially inherit a corneal eye disease from your mom or your dad, or sometimes it'll skip a generation, and you can get something from your grandmother or an aunt or uncle far off. Sometimes people know their sister has something, but they didn't really know that their parents had it, because maybe their parents didn't live long enough for them to know about that. So yes, many corneal eye diseases or causes of clouding of the cornea, or even discomfort on the cornea, those are things that can be inherited. So if you have it, that's something that you would want to let your kids know about, or even talk to your siblings and let them know you have this. They could too. Some patient told me that they were diagnosed with keratoconus, and they were wondering if they were at risk for potentially losing their eyesight. Keratoconus is where the cornea, that front clear window, bows, and it assumes a cone-like shape. Can people lose vision from this disease? Yes, they can. But the good news is if it's detected and it's monitored and it's treated, that these days people with keratoconus do really, really well. And we have ways to even arrest keratoconus so that it will stop getting worse. So yes, you can lose vision, but if you keep up with it, you do well. What are some of the treatments available for corneal eye disease? Well, we mentioned some of them. There are treatments for things like keratoconus that'll make the cornea stronger and it'll help it to no longer bow. There are surgeries where we can replace parts or all of the cornea with corneal transplant. There are laser treatments for corneal disease where we can smooth out the cornea and let it heal back normally. So some corneal disease is simply treated with medications. Some corneal disease can be made better, or the vision can be improved with simply contact lenses. So we have a lot of ways to treat the disease, and we have very few people these days who really lose vision from corneal disease. It's much better than it was 30, 40, 50 years ago. We got a lot of hope for patients who have this. Is there a difference between corneal eye diseases and corneal conditions? Well, in this question, I'm going to assume that the disease yes, there's a difference between the disease and some conditions. Some conditions that you have, you may acquire them, like a scratch on your cornea that never really heals normally or leaves a scar. That condition may cause you to have some chronic irritation, may require that the cornea be smoothed out, but you may have a corneal disease that you inherited from your family. And then in that case, that corneal disease may never ever give you trouble, and it might. And so the diseases are something that you may not be able to get rid of, and the eye condition may be something that is easily treated and it can go away. So, what are some of the risks of corneal eye disease going untreated? Well, kind of like with keratoconus, we have good treatment, but if the patient doesn't follow up, isn't diagnosed, doesn't get good eye care, they may never know that they have it, and therefore The treatment can't be provided to either stop it in its tracks or to keep it or to treat what you already have. So you can lose vision from corneal eye disease in other countries that aren't as well developed as ours. Corneal eye disease is one of the leading causes of blindness, but that isn't so much the case in our country anymore because we have such good treatments, good surgeries, and we can offer medications sometimes to keep things under control. Someone wrote in and asked, my husband was just diagnosed with keratoconus. What are some of the questions we should ask our ophthalmologist to understand this disease better? Well, as I mentioned, keratoconus is a disease that causes that clear cornea to bow and assume the shape of a cone. So if you knew someone who had keratoconus, and I have someone in my family who has it, the important things that my family member asks and that patients ask me are, how bad is my keratoconus? Because it may be very moderate, and it may be something that we can see it, we can tell by testing that you have it, but it's never going to get worse, and it's never going to cause trouble with your vision. So maybe you just have this keratoconus that is kind of really just stable. It's just there, and it's not going to get worse. So you want to know, what is the level of severity of my disease? So say, for instance, you have significant keratoconus, or your husband does in the case of this person who wrote in. The keratoconus is very significant. What you want to know is my disease changing? Because if keratoconus changes, and many corneal disease change, you want to know, do I need treatment at this time? Because if you need treatment, we know that many things can be arrested or corrected with either lasers or surgery or things like that. So how bad is my condition? What is my condition progressing? And do I need treatment? Those would be things that would be really applicable to any corneal disease. One of the questions I got were, are there any demographics that are more susceptible to corneal disease than others? Well, the answer to that is really no. Is a cornea worse if I live in is a corneal disease worse if I live in a certain part of the country? Is it worse depending on my age, my gender? Certainly, all diseases are more common as we age. Almost everything gets a little worse as we age. So yeah, aging is a risk for corneal disease. But anything else that makes it worse, being a man or a woman, no, not necessarily so. Living in a certain part of the country, no, not necessarily so. Your risk, just like our risk for everything, increases as we age. One of the last questions is, can you reverse some of the damage of corneal diseases with surgery? And the answer to that is absolutely you can. Some corneal diseases and the symptoms of them and the vision loss because of them can be reduced with surgery or laser. Sometimes medications will help corneal diseases. So it's important to know what you have and to know, again, is it getting worse, and is there something that I could or should be doing about it? Thank you for joining us today, and I hope I answered some of your questions about corneal eye diseases. It's been my pleasure to talk to you. I hope you'll keep up with us on our Facebook page or on our website, and we'll be announcing future sessions at that point. I hope you'll have a wonderful day. Again, I'm Dr. Janis Holt, and it's been my pleasure to talk to you about corneal eye disease. Stay well.